Hello and welcome. This is Bhaskar Napte from Pharma Growth Hub and we are discussing warning letter received to Granules India Ltd on 26th February 2025. In the earlier video, we discussed about the observation number 1. In this video, we will talk about the observation number 2. So, the FDA cited a serious concern under 21 CFR 211.58, which requires that buildings used for drug manufacturing must be maintained in a good state of repair. However, the inspection revealed unacceptable conditions in the AHU area, including bird droppings, feathers, and other visible contamination on air ducts, tanks, and surrounding floors. And such finding directly compromise the quality of air reaching critical manufacturing zones and hence pose a significant contamination risk. The specific regulation violated here is 21 CFR 211.58, which clearly states that manufacturing buildings must be maintained in a good state of repair. And this is not just about aesthetics or routine cleaning. It is about ensuring the building, its structure and environment are fit for production of safe and effective medicines. The moment you allow cracks, leaks, or paste ingress, you are exposing your product to the avoidable quality risk. So, what is the key findings from FDA? And let us now review that. So, inspectors found bird droppings and feathers on multiple surfaces inside the AHU area, including purification units, ducts, tanks, and floors. What is the source? Multiple gaps in the exterior facility walls through which birds were entering the area. And this not only reflects poor facility maintenance, but also raises red flags on air quality, product safety, and pest control systems. Now, in their response, the firm's response, the firm acknowledged the issue and installed nets to block bird entry. However, FDA deemed this response inadequate. Why? Because there was no deep root cause analysis, no assessment of other vulnerable zones, and the netting still allowed small animals like insects to enter. So the FDA expects not just a quick fix, but a thorough risk-based response addressing both cause and prevention. Let us reflect on likely root causes behind this observation. The one is poor structural maintenance allowed pest ingress. 2. Lack of proactive facility inspections which delayed the detection. 3. Ineffective pest control and housekeeping which is compounded in the risk. And finally, absence of strong engineering oversight led to failure in upholding GMP standards at a basic infrastructure level. Now comes to the most important part, corrective and preventive actions. The firm must immediately sanitize the AHU area and verify its cleanliness. Next, all wall gaps must be sealed and fine mesh insect-proof nets must be installed. Also, they need to conduct a facility-wide audit to detect similar risks in other parts of the building. So, these are not just repairs, they are restoration of GMP confidence in the manufacturing space. So, to prevent a reoccurrence, the firm must implement a robust preventive maintenance program. And this should cover routine building inspections, AHU checks, and repair schedules. So, they must introduce digital monitoring tools for early warning on environmental risks. Maybe weekly walkdowns by engineering and QA, which must be supported by documented SOPs and should also have the checklist. And ensure that the cross-functional management reviews are held monthly to track facility health. So this is about turning a one-time issue into a long-term compliance practice. And here is implementation timelines. I mean, this may not be a very accurate one, but based on my understanding, week 1 to 2, cleaning, sealing, and netting upgrades. Then the next week, that is the week number 3 and 4, conduct a full facility audit. Then week 5 and 6, you can launch a preventive maintenance SOPs. And week 7 onward, start digital monitoring and monthly review meetings. So this phased approach, week-wise approach, ensures quick action, also a systemic control, and also the regulatory confidence. So in conclusion, this is the way forward. So maintaining facility hygiene is not just a compliance requirement, but it is a patient safety commitment. Companies must move from reactive cleaning to a preventive design thinking. Also invest in smart infrastructure, empower maintenance teams, and most importantly, embed oversight and accountability at every level. Because a clean, safe facility is the foundation of trust in pharmaceutical manufacturing. So thank you so much. Here is the end of second observation, and I would like to meet you in the next one where we'll discuss about the third observation.